Afternoon. This is Dr. Kris from Direct Family Chiropractic, and I have the honor of being here with my good friend and mentor, Dr. Lisa Geiger. Now, Dr.
Oh, and I'm here with my friend. Go ahead.
Dr. Lisa's chiropractic journey has really taken her like all over the world. She went to chiropractic college out on the West Coast in California. From there, she practiced a year in Scotland and then went on to practice 7 years in Sweden. And in 2004, she came home to Massachusetts with her son, Jacob, and established a thriving pediatric practice in Brookline, Massachusetts. Lisa, thank you so much for being here today.
I'm happy to talk to you from my mobile chiro unit.
I love it. I love it. Yeah. So your office is very different from the typical chiropractic office. You see almost 2/3 of your clinic is like pregnancy and pediatrics, which is really very unique in the chiropractic community.
It's funny because I don't realize that until I go into other chiropractic offices. Yes, we have just kids and pregnant ladies everywhere.
I love your office. It's such a great environment and a really a great healing space. So your years, overseas really gave you some unique perspectives and unique techniques that you use to approach pediatrics and pregnancy. Can you speak a little bit about it?
Yeah, I'm really lucky. I actually started out in Life East in Georgia, finished at Life West, went and practiced in Scotland, and then went and practiced in Sweden for quite a while. And in Sweden, it was very frowned upon at that point to work a lot with children. But a wonderful woman named Dr. Joyce Miller came over from the British school, the AECC, one day and talked about the program they were putting together to study pediatrics and chiropractic. And so 3 of us started flying over there every month and learning everything we could. It's a bit different than the American program. So it focused a lot on embryology and how things really come to be the way they are. Different ways to approach things that you see. Subluxation based, yes, but also looking for different clues than they teach in the program in this country. 2 very worthy programs. And I hear there's another one out there. Maybe I'll just go for the Triple Crown.
You might as well, right?
Yeah. And then I had the honor of running into a wonderful woman named Svetlana Mazgotova, a crazy Russian woman who practiced out of Poland. And she was looking at persistent primitive reflexes and what the retained primitive reflexes say about a child and about their history and about their future and ways to change their future. It's been a lovely thing to blend into the practice.
Very nice.
Yeah.
So what are some of the why are you so passionate about taking care of women during their pregnancy? Like, what drew you to this line of work?
I've always been curious. They taught us some in school, but I was pretty much a sports chiropractor until I started working with the kids in Sweden. And then when I had my own birth, I didn't know very much about the birth process, what chiropractic could or could not bring to it, that many women who have babies who are chiropractors end up having very challenging births because we've twisted up our bodies for years to do what we need to do. So I ended up with a long labor, an emergency C-section I did not want or plan for. I had chiropractors laugh at me because it ended up that way. They thought it was pretty funny. But people are people. So I got very passionate about making sure nobody else ever felt that way about their birth. Woman comes in wanting a specific kind of support to get to a specific kind of birth. That's fine. It may not be my vision of what a birth might want to be. It's going to be theirs. But I'll do everything with heaven and earth to make it happen.
Yeah, no, I find that women have very different definitions of what they want when they say they want a natural birth. And for me, what a natural birth is very different from what they might perceive as being a natural birth.
I've had patients come in and say that. What was your birth like? Oh, it was natural. Okay, so what's that mean to you? Well, first I had my epidural, then I had some laughing gas, then there was this, then there was that, but it came out the vagina, so we're good.
Like I said, very different definitions. So I often have to ask, what does natural mean to you when I'm interviewing when I'm doing the intake for pregnant women?
Exactly, right?
So what are the benefits for a pregnant mom under chiropractic care?
Well, there's so many different parts to break it down into. For one thing, they're just going to feel better, and they're going to be working at a mechanical advantage. You know, every day a woman's body is changing. The center of gravity is changing. The weight is changing. Her relaxin levels are changing. And so any small challenges she may have had in the past can sometimes turn into big challenges. Hold on one second, please. We're going to move the mobile Chiro unit. What are the chances, right?
Yeah, what are the chances?
All right, we're going into the sunshine, people. All right, there we are. Tell me that's not hysterical. All right, so everyday things are changing, and you just have to adapt like we just did, right? Exactly. And the body will adapt better if it's mechanically well aligned and if it's neurologically clear. Women under chiropractic care, they have on average a 23% shorter labor, which means it's easier, it's safer, it has less chance of going down the wrong path that they don't want to go down. That 23% shorter labor usually comes out to be about 5 hours shorter labor. And that's phenomenal. Yeah, that's just phenomenal. Right. I love that. I love that statistic, but the truth is also that after about 5 years of saying, yay, 5 hours, something in me said, but why? Why is it shorter? Why does chiropractic make this happen in a smoother, easier, faster way? And we found a lot of it came down to the alignment of the baby on the way out. Babies are programmed with primitive reflexes that are actually activated by the internal geography of the birth canal in a well-lined up birth. So as they're rotating out, certain things will get triggered and they'll be pushing and twisting and twisting and pushing for a good exit strategy. And hey, if we didn't learn anything from George Bush, it's have a good exit strategy, right?
Absolutely.
So, so if the baby is coming down in a less than optimal position, those reflexes won't get triggered and the mom has to do all the work. I personally like setting the idea that the baby should help out around the house early. So I like to set up a birth where the baby's going to participate, right?
Yep.
Yeah, and then mechanically, the pelvis has to be able to be aligned and move with the tailbone moving the way it should to allow the baby easier passage on the way out as well. And so I really have to reword it. Chiropractic doesn't particularly give faster births. A body working the way that it was designed to will do the best job it possibly can, and that usually involves a safer, shorter, easier birth.
I love that. I'm constantly saying a body in alignment will work better every time.
It just will.
So many women are really hesitant about chiropractic because they think, number one, it's going to hurt them, and number two, it's going to hurt the baby. And they've heard from some people from their OBGYN, no, don't go to a chiropractor when you're pregnant, you know, baby will be crushed or something. I've heard ridiculous things.
That 2 weeks ago. We had a woman who came in who was debilitated with sciatica. The story is told with permission. And she had asked her 3 doctors, please, doctors, you know, can I go to a chiropractor? I'm 36 weeks pregnant. I've got a 3-year-old. What should I do? I can barely walk. The first doctor, her OB, said, don't go to a chiropractor. It'll smush the head. And the second one said, I'll pray for you because there's nothing we can do till the baby comes out. I'm not sure how you code praying on an insurance form. And the third one said, just take the last month off. I'm thinking that'll work with a 3-year-old.
Yeah, seriously.
So she gathered up her own research and she came in, and her results have been phenomenal. Her body is responding and thriving, and yeah, she'll be a chiropractic patient for a long time.
Well, that's I'm glad she, despite all the roadblocks, got to find you. So there are chiropractic adjustments for pregnant women are very safe. You are not going to crush the baby's head.
No. As a matter of fact, all the relaxing going on in a woman's body makes it so much easier to realign and adjust and make everything work better. So we can use much less force in order to help a pregnant woman's body align itself.
Yep. Are there any, a lot of pregnant women come in and ask, is this going to be painful for me?
Is this going to be what?
A lot of pregnant women ask, well, it might be safe for the baby, but is it going to cause more pain for me?
Occasionally, if there's a sore muscle that's really spasmed, it may have one last opinion before it relaxes. But most often we find that mothers have their bodies coming back to a normal state of ease and not discomfort. You know, you got to reframe what we're thinking about pain. Pain is rarely what's wrong with you. Pain is what's right with you. I mean, it's darn inconvenient. We're clear on that. But if your body is having pain, it's the only way it can tell you, hey, don't do this or there will be consequences. That woman's body was saying to her at 36 weeks pregnant, don't do this, don't walk, or there will be consequences, because her hips were so misaligned, it would have damaged soft tissue. It's a very smart body. We just don't like how it communicates.
I love the way you describe things. You have the best way of describing things. I just want to say that.
Right back at you, sister.
So I know I went into this last week with another Facebook Live that I did, but a lot of people are now seeking chiropractors out for the Webster technique. And Yay! I know that you actually met Dr. Larry Webster. So can you talk a little bit about the Webster technique?
Yeah, Webster technique is the Webster intrauterine constraint technique. Let's break that down. Dr. Larry Webster, an amazing fellow, he's the one who came up with it. Intrauterine, that, you know, we're talking around the uterus, and constraint means something's holding tighter than it should. Technique. So what it really does in simple talk is balances your pelvis so that your uterus can be in the best position for that baby to get into that great position to come out optimally, as they should, as they're capable of. So it for a long time was misnamed the breech turning technique, and that's not what it is. It's bigger than that. It's so much bigger than that. With the hips aligned properly and the uterus in the right place, the baby will find its way head down if it's safe. The numbers are, if I have patients coming to me at 36 weeks and their baby is breech, the research that I've looked at says 57 to 75% chance if you do nothing, that baby's going to find its way head down. All right. And if you add in acupuncture with the moxibustion, that brings it up to 80%. The studies looking at Webster technique, the babies are able to turn themselves 85 to 90% of the time. Larry swears that he had a 95% time of the babies finding their way head down. But I've not seen that in my clinic. So what of that last 5 to 10%? We can work with this technique and balance your body to the best of its ability, but if it's not safe for the baby to go head down, it's not going to do it. And what comes as a surprise is most people don't know why the baby goes head down in the first place. And that would be gravity. There comes a point between 29 and 31 weeks when the weight of the baby's head will gently draw it into the downhill position and it'll settle in. Before that, it's swimming laps. And so when they're head down, because gravity's pulling them there, all is as it should be. If that baby is not head down, you have to think that there's a reason blocking them enough to even just fight gravity. To not give into gravity for 16 hours a day when mom is upright means there's a pretty significant thing to be overcome. If you remove the blockages within the pelvis, the baby will find its way head down if it's safe. But if that cord is too short, or if it's implanted too high, or if it's wrapped around the baby in an inadvertently bad way, that baby will not go head down. And I like to trust that innate wisdom that's in the process.
I love that. Yeah, I've heard a few chiropractors who, you know, the chiropractor was adjusting his wife, and he was so frustrated that the baby wasn't going head down. And it turns out that cord was so short, and thank God the baby didn't go head down, because she would have had a rupture. So
they're smart little goobers. They really have an innate wisdom. So check this out. On the 16th day of pregnancy, the neural tube starts to form, which it's like bringing in the electrician at the start of building a house. It makes sense, right? Absolutely. But that neural tube goes on to become the brain. And I get this picture now of this little brain in a red hat and red tennis shoes like Disney, right? And the brain sits there and watches everything develop cell by cell. Everything exists exactly where it's supposed to. That's a liver and that's a toenail, and they don't get mixed up.
The nervous system coordinating everything. Yep.
Everything. They come out and they're able to manage their own blood pH. Check that out. And they can nurse and they can poop and all kinds of things they didn't know how to do a day ago. It's amazing. So we strongly underestimate the innate intelligence of the baby, the birth process, everything. I was speaking with a patient this morning, new patient, who said, today's my birth date and my due date, and if I don't give birth in 2 days, they're gonna
Gotta
Help
induce them.
induce them. Yeah, thank you very much. And we had a little talk about who's the consumer in the birth process. And a due date just means 50% go before, 50% go after.
Exactly.
It's
It's
very
an average. Yep.
one should always ask one's mother how the other births went. Does our family tend to go late or early? You
Yep.
know, what's their history like?
Yeah, both of my kids came after 41 weeks. It's just how long we
Really?
cook for in my body. Yep.
That's one. You're a good cooker.
Yep. And yep. I think they were just comfortable in there. They didn't want to be rushed.
Well, who would?
Right? And I just want to reiterate about the Webster technique because I did touch a little bit about this last week, but it is not a breech turning technique. It is a chiropractic adjustment.
Absolutely.
Designed to balance the pelvis. And like I said, usually a beneficial side effect is baby goes head down, as you said, if it is safe.
Yeah.
Now, what about the women who are trying to get pregnant? Can chiropractic help them?
Their body can help them, and chiropractic can bring them to that moment. It's beautiful. A lot of people have come to my office over the years thinking they were infertile, so they'd long since stopped using birth control. And then as their hips get lined up, the nerve supply to their uterus and their fallopian tubes and their ovaries and everything is restored to what it originally should have been, what we like to call factory settings, since we're in a car. And suddenly they're firing off eggs and they didn't realize it, and suddenly they're pregnant. And I've yet to have one named after me, but nonetheless, their bodies are able to step back into that place of fertility and creation and make a miracle.
Awesome. And it's all about restoring that nerve supply and restoring, as you said, factory settings, getting back to the body being in alignment and knowing what it needs to do.
Yes. Very smart body.
All right. How about some fun ones? A patient calls, "Hey, I'm 39 weeks pregnant and my baby is still breech. Help me."
First thing we do is roll our eyes. Second thing we do is get them in as fast as we possibly can. And sometimes coming to that late to the game, relining the body, it'll jump in with a vengeance and everything will come out fine. So we'll start adjusting, clearing the nervous system. This allows the body to be in a state where the baby finds its way head down and wham, we're good. Sometimes at that point, they're really dedicated to not having a C-section. And if the baby doesn't want to turn, there's still a handful of doctors in Boston who will joyfully do breech delivery. So you may or may not be familiar with that, but up in Boston, there's a couple of folks who are still doing that.
That's wonderful. And I know the midwives who assisted in my births, they both said that they've delivered breech babies too. So there are people out there. But yep. Oh yeah, because my midwives are the best. Jessica and Sarafina, they got that.
Oh, that's wonderful.
Yeah.
Oh, that's amazing. Yeah, they're the best ones. Lots of love out to those guys. They're wonderful. Let's see. What is the other questions in there? So first we try and everything we can to balance the pelvis. We see if the baby can make its way head down. If it can't, there's many different options. If a woman is not comfortable with doing a breech birth and wants to go for C-sections, there's so many ways to personalize that process aside from the standard institutional format. So we try and find the way that the parent is most comfortable with. It really comes down to their sense of self and their fortitude and their path and what their goal is.
Cool.
So, yeah.
And now we talked about pregnancy. What about after baby's born? What are the benefits to chiropractic after a baby comes through?
Well, in our office, if a woman's gone through care during pregnancy, we tell them that we really like to see them and the baby on their way home if they're doing a hospital birth or even a birth center birth. And they're stunned by this, but I say, the sooner we can reset your pelvis, the happier you're going to be. And we need to check the baby at that point too, because you ever see Fred Astaire dance with his grace and his leaps and his time in the air?
That was gorgeous.
Everything, it really was. And everything he did, Ginger Rogers did backwards in high heels. So everything just happened with a woman during birth, the baby did with their head. It's insane. So we come in, we gently check the babies. Now, if you think we were gentle with the mamas, we use no more pressure than you might use to check a tomato for ripeness. And people are stunned that it can make such a difference. But it helps their bodies calm and balance and get back to their factory settings. And they're a hell of a lot closer to their factory settings than we are.
Yes, absolutely. I am going to have you back at a later date to talk all about the benefits to getting babies under care, but that's a topic for a different time.
That's
sorry, go for it.
I was thinking that I forgot to say before, which is that 39-week pregnant woman who comes in, she's friends with 10 other pregnant women. You can absolutely be sure of it, and probably 3 who just delivered. So I tell them, when you buy a Volkswagen, suddenly everywhere you look, you see Volkswagens, right?
Yep.
When you look around your community, when you come in 38, 39 weeks pregnant and learn what's going on with your body and what can support and help you, suddenly you want to tell every single person that you've met, oh my gosh, you need to get under care. If not, Dr. Lisa, let's find you somebody in your area. I constantly send patients down to you or to anybody who's good with this stuff. Yep. So right now, roughly 5 to 8% of the population is under care. I think the more we increase those numbers, particularly with the pregnant women, the better our community is going to be in terms of health and perspective and ease. Really, really.
I completely agree. Is there, for people who are looking for any research on chiropractic and pregnancy or any place to get more information, where would you send them?
I would send them to the ICPA. These guys, we are so lucky to have them in the United States. Yes. It's Jeannie Ohm in Pennsylvania runs a group that Larry started called the International Chiropractic Pediatric Association, ICPA. And they have a website for the parents that's just chock full of information. Get your pen out. You're going to want to write this down. www.icpa4kids.org. That's www.icpa4kids.org. If you're a chiropractor and you want to go to the doctor's site, same thing, www.icpa4kids.com. Very easy to find that stuff.
And I will put a link to that in the comments section of this video for anybody who's interested.
You're so cool. Hey,
anything else you want to add?
Yeah, tell me something neat that you've seen in your clinic with a pregnant woman recently.
Oh man. Well, it's interesting because people always ask me, what are the difference between going through pregnancy with chiropractic and without? And I really can't say because I went through both of my pregnancies under chiropractic care, and I really couldn't imagine not doing that with all the changes my body was going through. Chiropractic care was just vital in supporting me through this process.
Absolutely.
So, I mean, we've seen, again, the mother who has 2 kids and she's 39 weeks pregnant and just wants to keep up with her kids until the baby's born. Chiropractic plays a huge role in that, just making her more comfortable, making it so she can, still run around with the kids and be an active mom when she's when she's at term.
That makes sense. That makes good.
Yep.
What was I going to add on? There was one more thing. That's fun.
It's all good. So if people are interested in what you've had to say, how do they get in touch with you?
Oh, yeah, got it. Our clinic, you can find us Village Family Chiropractic of Brookline, LLC. You can go to our website, www.villagechiro. It's improving somebody who can provide the services like you and I, they'll go back to that ice.org link. You can find a doctor there, and that's the place.
We kind of lost you a little bit there, so just so people know, because I think the connection's getting a little bit bad, but I will put a link in the comment section to your website too, because you broke up a lot there. But she's right on Harvard Street in Brookline. She's got a phenomenal little practice. There's a wonderful woman. Her name is Dr. Jillian. She works there too. For anybody who's been through our office, Dr. Jillian interned with us for a little bit, so she's working up with Dr. Lisa now. I want to thank Dr. Lisa, for being with us today. This was wonderful. Thank you so much for all the information and everything you do for our profession. You're the best. Now, this is Dr. Kris from Dinette Family Chiropractic.
Right back at you.
Oh, thank you. So, as always, we are here to help and serve you in any way we can. This is Dr. Kris from Dinette Family Chiropractic in Easton, and I hope you have a wonderful rest of your week.